Welcome to the Harbor-UCLA Emergency Department. We are happy for the opportunity to care for you and your loved ones today. Your care today will be provided by a team of doctors, nurses, social workers, and other emergency department staff. We hope this video will help outline what you can expect from your visit today. First, you will need to check in at the front desk. One of our nurses will ask you some basic questions about the reason for your visit. Please be sure that you have your ID and phone number available for the check-in process. Examples of ID include your insurance card or your driver's license. Next, you will be seen in one of our triage rooms. A team made up of a nurse and one of our providers, either a doctor or nurse practitioner, will ask you more detailed questions about the reason for your visit. Your vital signs will be taken and your provider will decide if you need any sort of testing or treatments right away. After triage, you will go through our registration process. Our registration staff will collect some basic information from you. It is important for you to know that we care for everyone equally, whether or not you have insurance. If you do not have insurance but are interested, our team can help see if you might qualify for emergency insurance. Be sure to ask about our patient portal, where you will be able to see all of the results from your visit right away. After you go through registration, it will be determined if you might be eligible to go to our urgent care. If so, we will make you an appointment with urgent care either today or within the next 72 hours. The next step involves going through our testing and treatment area. Based on the reason for your visit, your triage provider may have ordered some testing. This testing might include blood tests, urine tests, x-rays, or COVID swabs. If your triage provider ordered medicine for you, you will receive it at this step too. This process might take anywhere from minutes to hours. After you go through the testing and treatment area, you will be asked to wait in the waiting room until an open treatment space is available for you. Please remember that waiting times will be different for different people depending on the reason for their visit. We also have different treatment areas. People with minor complaints or those that need fewer tests and treatments might be seen in the fast track area, while sicker patients or those that need more tests and treatments might be seen in the adult ER. You will be checked on periodically by our team of nurses to make sure that we can keep you as comfortable as possible while you wait. This step might be several hours depending on how busy the ER is. If you have any questions during this step, please go to the front desk. When a space has opened up in the ER, your name will be called for you to enter the ER treatment area. Here, you will be cared for by another team of nurses and doctors. Your results will be reviewed, and we will complete any additional treatment or testing that you might need today. This process can take up to several hours, depending on what is needed to provide you with the care that you need. Here are some frequently asked questions that we wanted to answer. What is the emergency department average waiting time? Unfortunately, this varies on many different levels. Because there are no appointments, the number of people seeking care and your reason for visit will affect how long you might wait today. How long do tests take to result? Test times will be different for each patient, but the general expected time is 2 to 3 hours for blood work, 1 hour for x-rays, 4 to 6 hours for ultrasounds or CT scans. Once your tests are complete, it still may take time for a treatment space to open up for a doctor to review them with you. If you sign up for the health portal, you can access your results as soon as they're available. Why did the person who checked in after me get taken in before me? The emergency department uses a triage system to identify patients with more serious health conditions to get them treated more quickly. Most of our patients are triaged within 30 minutes of arrival, sometimes a bit longer when many patients arrive at the same time. This assessment determines the emergent need of each patient and the order in which they will be treated. There are also multiple treatment areas in the ER: trauma, critical, adult, pediatric, and fast track or urgent care. The wait times for each of these areas is not the same. As a trauma center, we frequently get critically injured patients who take a lot of time and resources to stabilize. These patients take resources from other treatment areas, prioritizing care for the sickest patients. Patients not only walk in the front door, but also arrive by ambulance. Ambulance patients go through the same triage process and may also end up in the waiting room. Why aren't all the tests completed while I'm in the emergency department? Tests in the ER are done to help identify life-threatening conditions. The doctor or nurse practitioner will determine what tests are necessary in determining your diagnosis and treatment needs. The results of some specialized tests are not available for several days, and we will call you if your results are abnormal. Some conditions require ongoing care beyond the ER visit. This will require follow-up care with your primary care provider or a specialist who may perform additional tests at that time. Procedures such as biopsies and colonoscopies need to be scheduled with a specialist. Will my pain get treated? The ER doctor or nurse practitioner will assess your needs and provide appropriate emergency intervention and care. You may be referred to your primary care doctor for chronic conditions. ER doctors do not refill prescriptions for narcotics. You will need to follow up with your primary care doctor or your pain management doctor for this. You will be reevaluated periodically during your stay in the ER. After your initial treatment, if you are still having discomfort, please let your nurse know. Please let our staff know if you have any other questions during your visit. Thank you.